Hello, welcome. My name is Dr. Calliope, and I'm going to be performing your examination today. How are you doing, by the way? Good to hear. Well, let me just grab my clipboard and we can begin, okay? So would you mind just confirming your name and date of birth for me? Okay, Chadley Chase. Excellent. Jot down that date of birth. Wonderful. So it looks like we have you booked in for a cranial nerve examination today. Is there any particular reason that you are having this visit? Okay. Just jot that down. Excellent. Okay, I'm going to ask you a few questions here, and then we'll begin on the examination. Are you in any current pain or have any current illness at all? Wonderful. Any changes to your medical history that we have on file? Excellent. And what about your family history? And any changes to your allergies at all? Okay. And your medication list. Any changes to that? Okay. You hear that? It seems we have a family of European starlings that have taken up residence within the building. I do apologize for their noises, but they're just doing as starlings do. I hope it doesn't bother you too terribly. Okay, so let's go ahead and move on. So the cranial nerve examination. For the cranial nerve examination, we are going to be doing tons and tons of tests for you. So we'll start with your sense of smell, your olfactory nerve, and we'll end with moving your tongue around with the hypoglossal nerve and everything in between, testing your eyes, your sensation, your ears, your muscle movement, and whatnot. So if you would like, I can grab a little chart real quick and we can just run down all of the nerves and what they govern if you'd like. Okay, I'll be but a moment. Here we are. Little homemade chart for you. So this is the list of cranial nerves, and it's a little extensive. It might look a little intimidating for those who have not really a clue what's going on with the cranial nerves, but there are 12 that we will be testing today. So as I said before, we're starting with the olfactory nerve, which governs your sense of smell, and ending here at number 12, the hypoglossal nerve. So number 2 is going to be your optic nerve. This governs your visual fields and acuity, so we'll be testing that with tests like the Snellen chart back there. We'll be testing your peripheral fields, and then we move on to 3, 4, and 6, the oculomotor, the trochlear, and the abducens nerve. These are all going to govern eye movement and pupillary response. So we test those all at the same time. Then we can move on to the trigeminal nerve, which governs sensation. And as the name suggests, with the tri prefix, trigeminal nerve is broken into 3 different branches. You've got your first, which is the ophthalmic branch, which controls the area around your eye. We have the maxillary branch, which controls around your maxilla, and the mandibular, which is around, of course, your mandible. Next, we have the facial nerve, which targets the facial muscles. we move on to the vestibulocochlear nerve, and this governs hearing and balance. And then we move on to glossopharyngeal, which helps with taste and pharyngeal movement. Then we move on to the vagus nerve, which does a whole lot. This helps govern some of your muscles, it helps regulate your heartbeat, it helps with pharyngeal movement, whole slew of things. Then we'll move on to the accessory nerve, which governs your shoulder muscles, their movement. And again, hypoglossal is for your tongue movement. So although you don't need a super clear definition of what all these nerves are or what we're testing, it helps sometimes to just tell you a little bit about what I'm doing. So I'm going to set this down. And we're going to start by testing your olfactory nerve. Now, real quick, for this test, I will be needing to touch you at certain portions of the exam. Is that okay with you? Do I have your consent to do that? Excellent. So, let's get started on the olfactory test. So, I'm going to have this little jar of smells that I'm going to pass under your nose. I just want you to tell me what you think it smells like, okay? Okay. Would you mind telling me what that smells like? Cinnamon. Very good. Let's choose this one. Okay, now if you can just close one side of your nose with your hand. Okay, I'm just going to have you smell. Okay, smells like toothpaste. Very good. It's mint. And let's see. Alright, and I want you to go ahead and just switch sides and close the other side of your nose. Very good. Okay, have a little smell. Yeah, a bit of an unpleasant one. That would be cloves. Okay, let me just put this back on. Okay, just going to take a little note here, and then we will move on to your optic nerve. So, let's see. To start with the optic nerve, I'm going to have you look at the Snellen chart back here. I'm just going to step back with the chart, and I'll ask you to just recite what is on the chart, okay? Alright. So, I'm just going to point my little pointer on different letters, and I just want you to tell me what letter you see, okay? Alright. Here. Good. Good. Excellent. 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 Good. 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 Okay, would you mind just covering your left eye for me? Very good. And can you read this line for me? Good. 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 Perfect. Now would you mind just covering your right eye for me, and you can uncover your left? Right, and let's do this one backwards. Excellent. Excellent. Excellent, 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 and perfect. Okay, you can go ahead and uncover both eyes. Let's keep going here. Yes, yes, very good, good, Good. Okay. Here. Here. Good. 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 Excellent. 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 Okay. Just got a couple more yet. Here. Mm-hmm. Mm-hmm. Good. 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 Very good. And last line, let's do this one backwards. Mm-hmm. Good. Good. Yes. Yeah. Mm-hmm. Very good. Okay, that was wonderful. Now let's see. Okay. We're going to go ahead and test your pupillary reflexes here. So this is what I call the direct consensual response test. So I'm going to put my hand up between us here, and I'm going to flash the light in, for example, this eye. When I flash the light into this eye, then that eye should react to the light, and that would be our direct response, being directly shined into. And then if I do that same eye and shine my light into this eye, your opposite eye over here should respond in the same way, and that would be your consensual response, as both your eyes are consensually reacting to the light. Okay? I'm just going to put my hand up between us, and just going to come in and direct, direct, direct. Good. Consensual, consensual, consensual. Excellent. Now let's try on the other side there. Okay. Direct, direct, direct. Excellent. Consensual, consensual, and consensual. Very good. Let me just jot that down real quick. Right. Here we are. Very good. Okay. There's a few more tests we can do for the optic nerve. So I'm going to pick up my pen light once more, and whoop. And we are going to do the swinging light test. So I'm going to shine my light into this eye, and then bring it to the other, and then the other, and then the other. Okay? Alright, so shine the light there, swing it over here, and over here, and over here. Once more, and over here. Excellent. Now, I want you to take a look at the tip of my pen light here. Okay? And I want you to just follow it using only your eyes without moving your head. Okay? We're going to go back and forward. Good. Back and forward. Back, forward, okay, and keep looking at the tip of the pen here. Back and forward, good. Back, and forward, and back, and forward. Excellent. Your accommodation reflexes are great. Okay. So now we're going to do what I like to call the finger wiggle test. So I'm going to stand back, and I'm just going to wiggle one side or the other of my fingers, and I just want you to tell me left or right when you see them wiggling, okay? Alright, so I'm going to step back here. Okay. Ready? I want you to just look at my nose and tell me when you see them wiggling, okay? Okay. Good. 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 Perfect. Perfect. Okay. Very good. Both. Okay. Excellent. So now I'm going to test your visual fields in that I'm going to have you cover one of your eyes, and I'm going to cover that same eye on my side, okay? And then I'm going to bring my fingers in like this, and I just want you to let me know when they come into view, okay? You can just say yes, or you can say whatever you'd like, okay? Alright, so I'm going to have you cover that eye. I'm going to do the same here, and I'm just going to be bringing in my fingers, okay? Very good. Good, okay. Excellent. Excellent. Good, okay. I'm going to have you cover the opposite side now, okay? Alright, just tell me when you see my fingers. Good. Good. Good, okay. Good. Good. Alright, excellent. You can go ahead and take your hands off your eyes. We're going to do one last test for the optic nerve. So, we're going to be doing what's called a fundoscopy. There's my light. Okay. So I'm going to be using an ophthalmoscope, and I'm going to be looking in each eye, and this allows me to take a look at the optic nerve itself, the optic disc, and I can just see all the little blood vessels, just make sure everything is all right, okay? So I'm going to I'm going to stand at one side or the other. I'm going to put my hand on top of your head, and then I'm just going to come in closer and just take a look around, okay? Alright, so I'm going to start over here. And let's see. Okay, I'm going to put my hand on top of your head here. Alright, I'm just going to look for the red reflex over here, okay? I'm just going to come in very close. Just have a little look around and just make sure everything looks good, okay? Alright, everything looked good there, so now we're just going to do that on the other side here. So I'm just going to put my hand on top of your head, and we're going to come in very close. There we are. Alright, just taking a look at everything around on the back of your eye. Very good. Okay, that looks great. Just going to jot a couple notes down with the previous tests that we performed, and then we can move on to number 3, 4, and 6. So now we are going to be testing your eye movement. With this, we're going to be doing a test called follow the finger. I'm going to have my finger right here in front of you, and I want you to follow my finger using only your eyes without moving your head, okay? I'm going to stand back, and I just want you to track my finger. Follow the finger. Follow my finger. You're doing really, really well. Appreciate your cooperation in this. Follow the finger. Follow the finger. Very good. Very good. Okay, now we're going to go up, down, okay, to the side, to the other side, okay, up, down, to the side, to the other side. Very good. Okay. How about diagonally up? Diagonally down. Diagonally up. Diagonally down. Diagonally up. Diagonally down. Good. Diagonally up. And diagonally down. Very good. Okay. 2 thumbs up. Finger guns. Very good. Alright, I'll just note that down real quick, and then we're going to check your trigeminal nerve. So, for the trigeminal nerve, as we talked about before, there are 3 branches along your face: the ophthalmic, the maxillary, and the mandibular, So I'm just going to be touching each of these regions with my fingers, and I just want you to tell me when you feel a touch. You can say yes, you can say whatever you want, okay? I'm gonna have you close your eyes for me. Close your eyes, okay? And just let me know when you feel a touch. Good. 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 Very good. And good. Good. Very good. Excellent. You can go ahead and open your eyes. So I've got one more facial sensation test for you, and that is going to be the sharp and soft test, okay? So I have a toothpick here. It has a slightly sharp sensation, but it's not going to break the skin. It's not painful, okay? Do you mind if I just touch you on the jaw so you can feel what that feels like? Okay, right there. Yeah, nothing too crazy. And then we've got our soft, which is little cotton bud. Do you mind if I touch you there just so you can see that? Okay, and right there. Okay, very good. So I'm going to be touching you in different spots on your face. I just want you to tell me whether the sensation is soft or sharp, okay? Alright, go ahead and close your eyes for me. Excellent. Okay. Sharp. Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Very good. So, did all of those sensations feel equal on both sides? Okay, very good. Alright, so I'm going to have you open your mouth for me, and then I'm going to try to press up on your jaw. I want you to not let me close your mouth, okay? So just go ahead and open your mouth, okay, and resist me. Very good, okay? Now I'm going to be testing a reflex. So this is going to be the jaw jerk reflex. I'll have you open your mouth just slightly. I'm going to put my finger right about here, and then I'm going to tap the hammer on my finger, okay? Alright, so I just want you to open your mouth slightly, okay? And tap, okay? Tap. Alright, very good. Thank you. And one last reflex for you. We're going to do the corneal reflex. So I've got a very soft little point here, and I'm going to have you look up. I'm going to pull your eyelid down, and I'm just going to touch this at the end of your cornea, okay? It will not be painful. It might be a little uncomfortable, but it's not going to be painful. Okay, do I have your permission for that? Okay. Alright, so let's go ahead and just pull your eyelid down here and just swipe that. Okay, very good. And on the other side, I'm going to pull your eyelid down and just touch. Okay, very good. Thank you. Alright, so next we're going to be testing your facial muscle movement with the facial nerve. So if you could for me, raise your eyebrows. Very good. Okay. I'm going to have you close your eyes really tightly and don't let me try to open them, okay? Okay, very good. Can you puff out your cheeks? Okay, I'm going to try to push them in. Don't let me. Very good. Can you smile real wide for me? Okay, very good. And can you purse your lips for me? Excellent. Okay. Have you noticed any change in taste at all lately? Okay. And has your hearing seemed to be louder than usual? Okay, very good. So I'm just going to do a little inspection on both your ears real quick, if you don't mind. Okay, I'm going to come to this side, and I'm just going to take a look around the ear. So looking at the preauricular area right in front of the ear, and I'm just going to pull the ear back and take a look at the postauricular area. Okay, very good. And just taking a look at the lobe, helix, tragus. Okay, all that looks good. Okay, I'm going to go ahead and take a look at the other ear. So first starting by looking at the preauricular area, and then pulling your ear back so that I can take a look at the postauricular area. Okay, just palpating the lobe and the helix of the ear, tragus, antitragus. Okay, all looks good. Okay, and there is no evidence of any lesions. Very good. So next we'll be moving on to the vestibulocochlear nerve, and so we're going to assess your hearing. First, we're going to do a little whisper test. So I'm going to whisper in one ear while covering the other. I just want you to repeat to me what you hear, okay? Alright, so I'm going to start on this side. I'm going to cover your ear. Just repeat back to me what you hear. Bristle brush. Feather. Glass. Yarn. Pink. Okay, very good. And the other side. Leather. Chair. Notebook. Jar. Glue. Okay, excellent. Excellent. So I'm going to grab my tuning fork real quick. We are going to be using the 512 Hertz tuning fork here. We're going to do the Weber and Renee test. So for our Weber test, I'm going to be striking the tuning fork. I'm going to be placing it right on top of your head. And I just want you to tell me if you hear the sound louder in one ear or the other, okay? So I'm going to strike this. Okay, I'm just going to place that right there. Okay. Can you hear the sound one side, the other, in the middle? Very good. Placing that in the middle of your forehead. Hear it on one side, the other, or both. Okay, good. Unilateral hearing, very good. So now for the Renee test, I'm going to strike the tuning fork and place it on the mastoid process behind your ear. And I'm just going to have you tell me when you feel it. When the vibrations stop, I'm going to place it in front of your ear. You'll tell me if you hear it. And then when the sound stops, okay? All right, very good. Okay, placing it behind you. You hear that? When's it stop? Good. How about now? When's it stop? Right then, okay? You hear that? Good. When's it stop? When's it stop? Very good. Okay, let's go again. Hear that? When's it stop? Okay, there. When's it stop? Okay. Alright. Okay, can you hear that? Very good. When's it stop? And can you hear that? When's it stop? Very good. Okay. Alright, one last little test for our vestibulocochlear nerve. I want you to stand up for me. Okay. Can I have you close your eyes? And I just want you to march in place. Okay, this is called the turning test. Just march in place. Okay, you can stop. You can sit back down. We are almost done. So we are going to test the glossopharyngeal and the vagus nerve. So I'm just going to take a look at your uvula and your soft palate. So I want you to open your mouth real big for me, stick out your tongue, and say ah. Okay. Just going to have a little look-see down inside your mouth. Okay. Alright, that one looks good. Okay, you can go ahead and close your mouth. Alright, so I'm just going to pour you a little glass of water real quick. From a bottle of water that has never been used before. It's brand new for you. Right in here. So I'm going to have you cough for me, please. Very good. And would you mind just having a sip of this water? Okay, you can hand that back to me. Very good. Okay, now would you mind just shrugging your shoulders for me? Very good. Now keep your shoulders shrugged and don't let me push them down. Very good. Excellent. So now I'm going to have you turn your head. I'm going to try to push against your head. I want you to resist me, okay? So turn your head against my hand. Very good. And other side, turn your head against my hand. Very good, very good. So that was our accessory nerve. And now for the last nerve, we're going to test your hypoglossal, your tongue movement. So if you wouldn't mind just opening your mouth for me, just letting your tongue rest. Okay, very good. Now can you stick out your tongue? Good. Can you move it up and down? Very good. And how about side to side? Excellent. You can go ahead and put your tongue back in your mouth. Alright, I'm just going to write a final few notes, but overall, you are all ready to go. Alright, that wasn't too hard, was it? Alright, do you have any other questions for me? Any concerns? Yep, you have a clean bill of health. There is nothing that concerns me in the least. Okay. Alright, let me just set this down then. It was absolutely excellent having you visit me today. I really appreciate it. So, thanks for stopping by. I hope you have a whale of a day, and I hope you have a good rest of your night. Thank you. Goodbye now. Thank you so much for watching. I really appreciate it. Please like this video if you want to, comment if you'd like to, and subscribe